Please welcome from the State Surgeon Cell, Dr. Felix Cabrera, who's also with the Physicians Advisory Group, and Sergeant Fernando Estevez. Dr. Cabrera.
Thank you, Janella. So today we wanted to give everyone a update on our current state. I'm going to share a quick PowerPoint presentation. Okay. So this year we are reviewing our current state. So basically we want to ensure that we describe the problem, our key insights, and the solution moving forward. So when we think about our current state, it's important that we remind ourselves what the actual problem is and what we were actually facing. So the SARS-CoV-2 virus can be spread so quickly that the COVID-19 disease overwhelms our healthcare delivery system. COVID-19 is especially deadly for our most vulnerable population, yet the healthy are the primary spreaders of the virus. The key insights: suppression strategies have relied on heavy social restrictions. By following new COVID-19 case rates and hospitalizations, it is proving to be effective in slowing the rate of spread. However, heavy social restrictions will not be sustainable in long term for most of the population. Therefore, we need an alternate solution that is indeed sustainable. The solution: the gradual replacement of the heavy social restrictions will be through improving the quality and quantity of both testing and tracing capabilities. Once in place, restrictions can slowly and safely be lifted, i.e. a phased reopening of Guam. So this basically states that we're not going to turn on the switch, we're going to slowly move up the dimmer. So I like analogies. So this here is an analogy of if you broke your leg and if you were to put it in a cast and it's now immobilized, how do you recover from here? After enough time has passed, you have to test it by bearing some weight on it. Pain and mobility will be your primary feedback that you will get on how you're doing overall. But eventually, once it's time for the cast to be removed, you don't just start running 5Ks. So what's the solution for that? If you have setbacks, you slow down for a bit. When ready, you try again, but with more caution this time. You repeat your physical therapy until you're functioning well. But also, you have to understand that there's a good chance that you may never be the same again. You may be back to your regular activities, but it may be in a different manner, in a different way. So I wanted to share this slide here where it actually shows a different visual aids and looking at how other countries are seeing spikes of deaths above reported COVID-19 related deaths. And so the question for us is Guam seeing the same type of spike? For example, here you look at New York City. When they took the average of all-cause mortality, so this is deaths from any cause, and they looked at several years, and the dark black line you see here on the bottom here is the average for that year, and the red is what is representative for 2020. And as you can see, New York City has almost 300% increase in overall deaths. In Madrid, Spain, it was 161%. If you go to in parts of Italy, 463% increase in excess deaths. So we wanted to ensure that we had eyes on this for Guam overall, because we've been able to report COVID-related deaths, but we wanted to ensure that we weren't accounting for some and that there's something else that we wouldn't have eyes on. So here is a slide looking at Guam's all-cause mortality from 2015 to the present. And so in this slide here, we actually started in November because that's when we think SARS-CoV-2 virus actually existed, and then trace that through October. And what you see in the gray are all the different years. It's not important which years these are, but the solid black line is the average over the past 5 years. And the red is our most recent months. And so as you can see, the red has been mostly following our average and in this graph here. So basically what this says is that there's currently no evidence of excessive deaths on Guam, either COVID-19 related or otherwise, when we examine all cause mortality rates over the past 5 months. So where are we now in terms of COVID-19 case counts? So as you can see, we're not going to be going over specific numbers here, but this is more visualization of how things have been have been trending, especially recently. So as you can see in the blue here, it's our total number of COVID-19 cases. The green line here is our new case counts per day, and then the purple is our hospitalization of COVID-19 patients. And as you can see, it's been going down and down. And this year, April 29, this is actually correct. We have now 0 COVID-19 patients admitted at GMH at this point in time. So this is a close-up of just the hospitalized COVID-19 cases and the new case counts. And as you can see, it goes up and down a fair amount, especially with the new COVID-19 cases. And so when we try and find the trend, sometimes it's easier to look at what's called a 5-day rolling average. In some cases, it could be a 7-day. But this is what it would look like here. So in this teal dotted line, it's actually a 5-day rolling average for the hospitalized census. And then the dotted orange here is for new case 5-day rolling average. And if you were to look at that just by themselves, it's a little bit smoother with less noise, and you can actually see a trend that's relatively manageable. In this case here, this is another metric that we've been following. It's Guam's test positivity rate. And this test positivity rate means basically how many tests have you done and how many of them are positive. And however many positive, that's your rate. So if you test 100 people and you get 30 positives, then your test positivity rate is 30%. What we've seen with that's been reported for many other countries is that if we get below 10%, then at least the initial part of the pandemic is probably at a more controlled state. Now, this is the assumption that you're casting a wide enough net to catch as many of the COVID-19 cases. What you can see here is when you look at it from a cumulative standpoint, that we are already below 10% of overall tests done and on our positive cases. What's really encouraging is that down here on the lower part here is actually the daily test positivity rate in relation to the daily positives overall. So this line here, this solid green line is what this is for the daily side, and you can see it's extremely low. It's been below 0.5%. And if we stay below that, and which we're seeing is right now 3% is kind of the magic number. If we stay below that, then it's one part of confirming that the pandemic is even more controlled after that the initial surge. You can see countries like New Zealand or South Korea that are having these numbers well below 3% as well. And so that was just a quick update of these facts and figures and graphs. It kind of lays the work for the discussion that's going to happen tomorrow, where the governor will be revealing the reopening plan for Guam. That again is going to be a very slow and phased-in plan, but it's going to require a lot of these metrics for us to see how safe it is to reopen, and also know when we have to pull back maybe a little bit. Hopefully that won't happen, and it's just a consistent stepwise opening that will get us closer to what we feel is normal. And with that, I'll go ahead and hand it over to Sergeant Esteves to give us an update on supplies.
Up Dave. So as mentioned, part of the way forward is going to be to ensure that we're able to meet current medical capacity as well as increased medical capacity. And then the third portion would be with a plan of action to be able to execute and rapidly expand that medical capacity in the event of a second wave or surge. In order to do that, we factor in multiple aspects: personnel, equipment, and supplies. Guam has actually done a very good job with regard to its PPE maintenance. There's a misconception that when the hospitals and healthcare facilities are reusing or using extended use policies with regard to their PPE, that it reflects a dire situation and a shortage. When in fact, the CDC guidelines regarding conservation of PPE recommend that this be done ahead of time before supply situations become dire. So Guam has maintained and done a great job in how they conserve it. That being said, the major players for COVID have maintained for the most part, and now are 30 days or more, and there's different supplies for different PPE items. We are tracking currently a shortage of regular non-medical face masks at the Guam Memorial Hospital. There are contingency plans in place, and our ordering is ongoing, and we do expect supplies to be coming in because they've been allocated by the different distributors and manufacturers. Moving forward, we're as part of this process to maintain and increase capacity, we're going to be having an organic stockpile here on the island, similar to what the national stockpile has with regard to PPE and other equipment in the event of a second surge or second wave. We will be using mathematical formulas for supply economy, particularly the EOQ formula, with making adjustments to that formula to account for variability in the lead time. And so we're going to be taking this approach to determine what that stockpile will be, both reasonable in supply to account for manufacturing issues, as well as making sure that it's economic for the government of Guam.
Thank you, Sergeant Estevez. And now we're ready to take questions. Just as a reminder again, one round of questions, and each reporter gets one question and one follow-up. We'll begin with Pacific Valentines. Johanna. 1 second, let me just unmute you. Stand by, Johanna. All right, Johanna, we'll get back to you. I don't see you here. Kevin Kerrigan, PNC News.
Yeah, good afternoon, everyone. Dr. Cabrera, how are you, sir?
Good. Good afternoon, Kevin.
I know I asked this question the other day of the governor, and we exchanged a couple of messages, but let me ask it of you now that we're in a Zoom conference. And that is, what does the second wave potentially look like based on the current tracking of this disease? What are your thoughts on how serious a second wave could be for us now that the first wave is past?
So thanks again for that question. You know, this is more opinion based than it is trajectory based overall in terms of how, as you say, how bad do I think it might be? There's been discussions about that. What will be the impact with COVID-19 and flu season as well? And so that's something that we haven't fully factored in. It's very difficult to predict how bad the flu season may be. But in terms of for COVID-19 itself, we in a previous press conference, we presented some range of a trajectory range basically. And one still had a pretty significant wave that would definitely overwhelm our healthcare system here. But then there was another one that was actually provided by FEMA, and that one took into account everything that we've been doing now and that we're likely to keep doing throughout this next several months. And so I think that's probably more representative of where we might be. That's assuming that we do everything correctly in our reopening phases. So it will be, the short answer to that would be, by itself, it would be equivalent to just a really bad flu season by itself in terms of what we handled from year over year in certain years. So it will be that there will be several more admissions in the hospital, maybe something not unlike what we've seen with this first wave.
So you don't feel that we face the potential of it being worse?
There is still definitely the potential for that, and that's why all the preparation and readiness that we're doing, that because we know what the potential is. But again, with our ability to mitigate in the way that we have, and then also do additional mitigation as we roll back some other parts, is going to give us a lot of confidence, I think, moving forward. The one thing is that there's a lot of time between now and October, for example, and there are a lot of different variables that could pop up on us that we just won't necessarily see, or even maybe the world won't see just yet, or predict. And so it's because of that, and because we're so at this point fragile, we have to be assured and ready.
Thank you, Dr.
Next is Nestor Lecanto, KUAM.
Good afternoon, Dr. Cabrera, Senator Esteves. First question is, Dr. Cabrera, you mentioned the possibility of setbacks and that we would have to slow down for a bit. I'm wondering if you could elaborate on that. What would constitute a setback and what would constitute slowing down for a bit?
Yeah, so that's the big question right now, and so that includes a lot of different factors. Most of it is, of course, related to the data we get from the healthcare side, but the reality is that we're going to have these different phases, and that's going to be discussed more tomorrow with the governor's reopening plan. And what that basically is that we may be having these certain phases, but there are different parts that will start adopting these phases. So in other words, again, it goes to that we're not going to just turn on a switch. It's going to be a slow dimmer that goes up. And even if we, for example, let's say that a certain amount of businesses were allowed to open up tomorrow, we believe there's going to be a gradual process of that. Not everybody's going to jump into that, and they're going to take their precautions and ensure that they adhere to any new requirements they may have to open their business. And so, but if we are seeing at the same time that that's happening, and we are starting to see a rise in new cases and a rise in new test positivity rate, for example, then that's a good reason for us to start being concerned. And if it reaches a point that where the governor does not feel that we, one, continue in our reopening process, or two, that it's so bad that we may have to go back to where we currently are, or some version of it. So it's really tough to say, but it is a moving target. And in the end, this plan that stays out has a lot of specific gated criteria, but it's meant to advise the governor, who ultimately will make those decisions based on a lot of different factors.
So there's really no way to project, for example, the likelihood of us having to halt the reopening or slow down the reopening? Yeah,
there is no very specific way. Again, we're going to do what's going to be in the best interest of all the citizens of Guam, and that we ensure that their safety comes first. What we've already proven is that our efforts have been very effective. We don't think that we would have to resort to the same level we are right now once we start moving forward, but there is still that possibility. But the odds of that are less and less, and so there will be parts where you be very specific about after this many days, if we don't see these cases, then that will be a trigger point for the governor to start really seriously looking at moving into the next phase. But there will be some visibility on that, and that the whole community can actually even kind of follow along and start kind of seeing when the writing might start being on the wall.
Thank you, Nestor.
You got it, girl. You got it.
Otto,
Wow, so it is.
wait,
With the recovery plan to be announced tomorrow, during the recovery, do you feel that, or do you know if public health will require any such inspections to ensure guidelines are met before businesses can reopen? And if so, how will that look like? Because I'm sure that, with business inspections moving forward, they won't be the same as they were pre-COVID.
Yeah, and so again, these are my thoughts, and these are actually going to be discussed in more detail. Is that it's going to be an effort that comes from basically different angles. So one is that these businesses are going to have to, of course, adhere to any very specific requirements that Department of Public Health imposes on them. But at the same time, they're going to have a basic reopening plan that's going to be looked at from the Chamber of Commerce. I'm sure is going to be a part of that as well. But then what I think is going to be the real enforcer here is actually the whole community, and it's almost like crowdsourcing enforcement. And what that means is that I think that the community is responsible enough and intelligent enough to see when a business is not adhering to standards that will put in danger people and basically call them out on it. And so we hope that there's that the community is willing to do that, and I think they will be.
Right. Okay. So we'll see what the details look like tomorrow then when the governor announces her recovery plan. And so I want to get to the question in regards to the equipment we have. Do we know right now how many test kits we currently have on island and what are the costs of those test kits? Additionally, what is your comment on allegations that test kits are being bought and purchased from suppliers or so-called middlemen that are just friendly to the administration?
So what I can say about the current test kits that are on island that public health has were test kits that were received from CDC and other governmental organizations. Within and with using emergency funding, which I've been the logistician about, I can say confidently there have been no test kits purchased using any of the emergency funds within my purview at this time. And that's partly because of the complexity with ensuring that the test kits are going to be usable. And as I think mentioned before and on many occasions, that's going to require the test kit, the compatible machine, the certified lab technician, the CLIA certified laboratory, enough specimen collection swabs to match the quantity of test kits, as well as the viral transport medium. And so once we've established all those supply chains, and we have a diverse sum of different PCR testing machines at this time, once we've established those supply chains, then we could potentially start looking at the procurement of additional testing. But you have to understand that each of these machines have different capacities on how many tests that they can run at a time. I think there's a misconception that when we say we're buying more test kits, that they're as simple as a pregnancy test or a blood sugar test. And that's not the case at all. These are high complexity laboratory tests. And so it's not a simple matter of a 1-for-1 test kit per person. And so with all those things, those are actively being worked on with the manufacturers of the different machines, manufacturers of the different consumables, such as the VTM, UTM, and specimen collection swabs. And so all of those things need to come together to perform a good PCR test that we can feel confident about the results. And an example of this you could see with not Guam, because Guam did a great job, but some of the jurisdictions that didn't use the proper viral transport medium with the Abbott test. And this was in other jurisdictions. And because of that failure on the logistics side, all of those test kits, all of those tests were invalid. And so these are the things that we monitor very closely. But again, to go back to your original question, I can say confidently with the funds, the emergency funds, using emergency procurement, to my knowledge, and nothing that's come across has there been any approval for a purchase of any test kits at this time. So the current test kits we're running, yes.
Allegations are untrue. And then can you also speak, do you have a number of the count of test kits we currently have on island? So
the number of test kits, I got a copy of that in the office, but public health tracks the test kits that they receive from the CDC. And so my realm is any test kits that would be procured. And so that's why I can say confidently that number is 0, only because the procurement needs is more than just the test kits themselves. It's matching up all of the other requirements to run that test. And so you have to understand when the CDC sends test kits over to Guam, they send it in a complete package. So you're including the specimen collection swab, the viral transport medium to utilize that. And they already know, and they're sending it specifically for the machine that it's compatible with, primarily the machines that we've received from the CDC and Homeland. Now, when you're procuring off the market, the international and global market, it's a piecemeal effort. So you would order the test kits from one person, collection swabs from another, and you have to make sure that they're all compatible, again, because it's a high complexity lab. So with regard of procurement of test kits, within my purview, with regarding emergency funds, I have not authorized or I have not vetted any test kits to move forward for purchasing. at this time. So that's what I could say, at least within my realm.
Thank you, Nick.
I'll take a part of the clarification in terms of Nick's question also was just to know that I believe that there was 110 tests that was performed yesterday overall, and that's a combination of from different sources. And so that's a fair amount. That's the most that we've done in one day, and that's something to note. In the previous presentation, we discussed how a goal of ours would be to have the capacity to do 152 tests per 100,000 persons. And so for Guam, that would mean approximately 258. Now, that's not how many tests we have to do every day. It's just the capacity. So in case there's a big, outbreak or, pocket comes up in terms of cases of COVID-19, that we'd be able to have enough capacity to do those tests right away. So the question that comes after that is, are we there, and when will we be there? And so based on where we are right now, it's clearly over 100. We have more modalities coming online, and the supply chain that's coming in, at least from as Linda has described it, that it's actually a fair amount, and it's fairly soon. So at least that box being check marked in terms of reopening may be satisfied as early as next week.
Thank you, Nick. Next is Adriana Patera with Island Report.
Hi, so my first question, Dr. Cabrera, multi-generational households, they're being encouraged to undergo testing if they have symptoms, but there are people who live in multi-generational households not presenting symptoms or asymptomatic, and some of those individuals have voiced concerns, or more so they're in fear that they may have the virus and infect their elders. So would you recommend they get tested too? And additionally, as we're discussing reopening the island, are there plans or discussions to bring in antibody testing?
So in terms of I think one of the best ways to answer the multi-generational home is to answer it first about symptomatic versus asymptomatic. It's extremely important that anybody that has symptoms that are related to COVID-19, that they should be tested, and then also that we should monitor very closely the household contacts, and if they have symptoms, of course they should be tested as well. If one of them becomes positive, then everybody gets tested, and that's the key part of this testing and tracing. So you're going to hear a lot about that, if not already. It's always about testing, then it's about tracing, testing, tracing, and our ability to do that is going to be important. The multi-generational homes, that's very you have one grandmother who takes care of a grandson. That's a multi-generational home, essentially. So that definition could be very broad. There are going to be efforts to look at, households that have, even in the double-digit amount of occupants that live there. Those are the ones that they may be a more targeted approach to offer them assistance in terms of testing. And so I can't comment further on that. That's really on the public health side, that they're coming up with their targeted plan overall to offer assistance. So it remains to be seen. For your second question, it was antibody testing. And so antibody testing right now it has a role. It definitely has a role in controlling this pandemic. In terms of the acute care of patients, its role is much less defined. And right now, I don't think there's good reason to believe that it will be. But overall, in terms of our understanding of prevalence and a person's ability to mount an immunity to COVID-19, even with the serology test as it is, there's not real confidence that actually proves immunity overall. The WHO was pretty staunch about that and said that there is no evidence at all. They walked that back a little bit yesterday. And so they're saying that, of course, there is some evidence that it can work. So it's not, so the antibody testing or serology testing, it's not going to be this magical immunity passport that you get, at least not for the foreseeable future. What the conversation in the medical community right now is really focusing on, again, rapid testing. The reason why serology and immunology testing, which is the antibodies, is really looked at because it can be a very fast test. But there is a counter to that, and that's called antigen testing. And so it's similar to what we do right now with the influenza virus. It's an antigen test. And so we're actually testing specifically for that. And it's done in a different rapid way, but it's not as accurate as PCR is. And it's definitely much faster. So what you give up in speed, you give up in accuracy. And so but the antigen tests are still being developed and still being vetted. But we think that, especially Dr. Brooks, back in over the weekend, she talked about this heavily, that they're putting their weight behind that, and that may be the next phasing and testing as we go on, especially into the fall.
I'd like to just add to that. Another thing, because there's a misconception about those serology tests. They are packaged similarly to other types of tests that you might do, and to provide quick results. But any of the, I want to say 7 now, serology tests that were approved by the FDA or authorized under the emergency use authorization still have a CLIA certification requirement for the reading of those tests. And so I think when you talk about serology tests and the speed and ease of use, it does not constitute a kind of drive up and do the test and get your results right then and there. It still requires the lab to do the reading. And so that's an FDA requirement as it stands.
Okay, and for my second question. Hello?
Yeah. Go ahead, Adriana.
Okay, sorry. So for my second question, Sergeant Esteves, can we get a complete list of inventory of what has been ordered for GovGuam, including the contracts and payments, and how much has been spent by GovGuam to date in total on the supplies and equipment for COVID? And since we have you, if I could additionally just ask, are there still plans in the works to open medical facilities for COVID patients that are non-ICU?
Okay, so I'll start with the first one, the short answer. With the plans to open up, those plans exist. And so they've always been based on trigger points regarding need. And so if the need arises, those plans will be executed and those expansions will open. It was never the intent to just have things open and sitting around. We did this approach very methodically, and there were trigger points. And so at this time, it doesn't seem like those trigger points will be met, but those plans are still in place, ready to be executed should the need arise. With regard to the what's been ordered, now, again, as stated in this process and my role, I don't micromanage any of the individual clinics and agencies, public health, GMH, GRMC, for example. They have their own medical materials supply people that order and continue to order supplies and equipment that within their budget. I have no eyes on them. What I do have eyes on are what they currently have in stock, what they expect to get in at times, and that's for very specific PPE items. With regard to what has been currently ordered and procured, the communications at Civil Defense, it's because they'd be the one to execute the final PO. Would be the ones to provide that to you. So in terms of PPE that's been ordered, I can't give a general estimate at this time. We've placed orders and at least started the process for around 75,000 N95 masks that were vetted from different manufacturers and different supply companies from off island, as well as gowns have been a particular issue. Currently still vetting more sources for ventilators because those are still a hot item. And then viral transport mediums is another thing that we're continuously trying to source so that we can look at expanding testing capability.
Thank you, Adriana. Next is Miriam's Business Journal, Lane Chargaloff.
Hello. A video put out by the Governor's Physicians Advisory Group encouraged patients who need treatment not related to COVID-19 to seek a treatment as usual. Does the medical community anticipate a sudden surge of patients, and will there be any challenges toward treating them when so many resources have been directed toward the pandemic?
So yes, in terms of that public service announcement, it was a reminder to both patients and providers overall that primary care and preventative care is extremely important. it's the cheapest amount of care that we can get for the most impact. And so we wanted to ensure that that was not going to be neglected, because the reality is that we've already seen that the effects of that in terms of the non-COVID patients presenting in a state that where they're very ill, and then needing to be admitted to the hospital, and then that being a wave in and of itself. So we're already seeing that, and that can really help motivate the message to go out to remind people that even if you can't come in, to call into the clinic and be sure to touch base with your doctors and the clinic, and then also encouraging telehealth, which is a big part. CMS has given Medicare in particular has given a lot of liberties for that, and so that we encourage that. I'll speak specifically for GRMC. Their subspecialty clinics have been using like approximately about half of it would be telehealth, but the other half would be in-person visits in one day, for example. So it's a process that's looked at very closely, but it seems to be working at least relatively well. Ideally, yeah, of course, our doctors want to see their patients in person, but in terms of just ensuring that they get the proper maintenance care, that this more than suffices.
Right. Okay. And as far as medical capacity, you were talking about under certain circumstances, you would look at testing around 258 people today for COVID. Are there enough medical personnel to support testing to reach that goal island-wide? What types of medical personnel are needed to run the test? Are they nurses or lab techs? And if the island were to if you were looking to increase the rate of testing, would you be able to grow enough people or have enough people to meet that need?
Yeah. So in terms of the test themselves, again, there's a variety of different tests. Their range of complexities vary. From the most complex, the high complexity, that's the one that we've been using from the beginning, the ABI 7500 at Public Health. For example, the only people that are qualified to run those tests are medical technologists with at least a bachelor's degree and certification in that. And so that's very highly complex. They're just as rare as nurses, for example, and so they're not easy to come by. So the staffing in that sense could be a limiting factor in terms of the rate of how many tests we can do. However, as we build up this armory of other tests that are not as complex, and then as it gets less complex, the requirements to do it is less. So the other example on the other end of this current spectrum for what we have here in Guam is the Abbott ID Nows. So those are actually have the exemption that they actually technically don't even have to be in the lab. They can be in the doctor's office. They could be actually in the emergency room. And so in that case, it takes a medical personnel that doesn't have to be a medical technologist to run those tests. But for quality control purposes, right now we do keep them in the lab, and because it doesn't take that many minutes to run it up to the lab and run it there, so there isn't as much delay. So, but that's the key there. As we get to the much more simple ones, like potentially the antigen tests that will be coming out in the next several months, I would think it's going to be even more lay persons can actually run that. Is going to be the likelihood. But just like, for example, pregnancy tests, you can pick it up off the shelf, and anybody is qualified to use that test and interpret that test as long as they can understand the instructions on the box.
Thank you.
Thank you, Wayne. Next is Guam Daily Post, John O'Connor.
Hello, everyone.
Hello, John.
Today.
Before I ask my first question, just want to clarify, was it stated earlier that there are 0 COVID-19 patients at GMH?
Correct.
Okay, so then as we talk about recovery, can you give us an idea of what the roadmap is going to be like for the hospitals? If there are 0 COVID-19 patients at GMH, or can we expect to see that hospital open up to other patients transferred from GRMC back into GMH? How do we see this going on in the future?
So I think what's important is that yes, everyone should feel good right now that there are currently no COVID-19 patients needing hospital admission on Guam right now. Not, of course, not counting our military partners. But in this situation, we are still maintaining GMH as the COVID hospital because as we start reopening, we think we have a good idea what's going to happen, but we have to be prepared because there's risk and benefits in everything we do. We think we've mitigated the risk, and then the benefits of opening up are rising up. But there is still the chance that there may be another surge that hits us very quickly. And if that's the case, we want GMH to be ready to still take on those cases in a manageable way that does not compromise the standards of care. And so it's not clear right now of the timing of that. And so are we actively decompressing GMH? No, we're not right now. And so it's just a natural order that a lot of the non-COVID patients are currently being treated at GRMC, but you still have a fair amount of non-COVID patients still being treated at GMH as well. And so we're still seeing that.
Okay, thank you, Dr. Kerber. The second question is somewhat related. Early on in this in the pandemic response, we saw people quarantined into several hotels. Eventually, the number of people quarantined were consolidated into a single hotel just because the number was so low. We know that the quarantine and the isolation facilities are going to stay, at least in the early phases of recovery. But while that's happening, and while the only one hotel is being used, are other quarantine facilities still being paid for? Are they still being paid as to stay open as quarantine facilities, even though there aren't any people there?
I really can't answer to that one because I don't know, and even if I did, I wouldn't be authorized to share that. But what I will say is that remember that that flights that still come in are still requiring to be quarantined overall, and until we have a good system where we can do rapid testing for travelers and be reliable, that some sort of quarantine way to accommodate them in a quarantine setting is going to still be important for the next coming months, I would think. But that's just my take on that, because it's not like we would have to just start just going back to saying, oh, we don't need them anymore, when the reality is that we could very much still need them.
Thank you, John. Next is.
That they're doing different levels, right? Different grades.
Okay, Jared Salon, EDM.
Hi, Dr. Cabrera. I wanted to ask about the testing that public health is doing at the gyms and stuff. Is that helping your group kind of get better data of what it looks like out there in terms of the number of infected COVID-19 cases?
Yeah, and so far it is, and again, what these testing drives have been has really helped us get obviously a better number of cases, and to the point where we've had the highest day of testing that we've had over the past 6 weeks or so. We're either 110 tests run on Guam, and that's a combination of these drives and also just from the hospitals and the clinics on island. So it's definitely giving us a much better picture. Again, what we've also relied on is what we relied on even from the past in the early weeks of this, that GMH's census is one of the key corollary in terms of what the prevalence is in the community. Because again, it's like it doesn't matter if you're tested positive or negative, but if you have COVID and you're really sick from it, you're going to end up at Guam Memorial Hospital seeking care. And so because we've seen that decline, it is matching up with what the results we're getting from this increased testing capacity. So that should make everybody feel a little bit more comfortable that this trend is a true representation of the prevalence.
And so the data that you have right now, that's giving you guys a better feeling of that COVID-19 on Guam currently is not, it's kind of slowing down. Would that be correct?
Yes, and then so that's why on the slides that were shown earlier was looking at the recent trends here. So yeah, we had several days where we essentially had no cases, and then you've had a few of these days where we're having like 1, 2, or 3, and then 0 again, and so forth. And so the reality is that we're going to get that, I think, throughout the next several months. And so I don't think it's that we have to think about this as completely stomping out the virus, although we would love that to happen. But the reality is that as long as people are susceptible on this island, it's still going to be a risk, and they're going to be susceptible until they have immunity or a good way to treat them. And so in that case, what can we accept as tolerable in terms of COVID-19's presence here, and in a realistic way, and not just saying 0. So we're trying to figure out what that number is and what we can handle. And it appears that if there's the new cases per day, it staying below 5 seems to be very, very manageable in terms of what we are seeing right now. And that even when we get up to 3 or so, that we're not seeing that necessarily reflect in the hospital overall. So I think those numbers are very important. As we reopen, we have to understand what's a tolerable amount, because you can't trend down lower than 0 when you're at 0, and it's not a fair representation when you're only looking, if it's fluctuating between 1 and 5. So just keeping that in mind, that there are different ways to look at these trends overall.
Thank you, Jarek. Next is Patty Arroyo from page 7.
Good afternoon, everyone. Hi there. I want to actually follow up on another question about the timeline for when this public health emergency will end. What are we specifically talking about? Is there a specific month that we're talking about?
So I can't speak for the governor in terms of when the declaration of an emergency is and when that might be lifted. But I think overall we have to understand several things that I think are clear, is that as we start taking more risk in terms of reopening, that's going to still have to be a very controlled state in order to do that in a responsible way. So that's usually still, of course, under a declaration of emergency. Now, as you move forward out and as you continue out, you're gonna see that in a way that is this still necessary to have this state. The reality is that we are not going to necessarily define that timeline. The virus is going to determine that timeline. And as we start going sort of back to what we are going to be considered normal, or what we are aspired to do in our daily living, is that it's going to require us to have really good control of this. And I think that still happens under a state of emergency. And until we can get to an acceptable level, that the governor is going to need to be able to be nimble enough to pivot when necessary as we make these changes.
I know that you can only address what you know medically, but the governor has said, and I quote, "We will have to continue extending our public health emergency till we actually stabilize our economy." And some people even say until we start getting vaccines and treatments to make sure that our people are not really testing for the COVID virus. From your perspective as a medical professional, which of these, the economy and the medical priorities, is the determining factor?
So as a medical professional, I'll just say that as long as that this threat is still extremely real, and that we are still seeing people hurt from it, and that it causes a tremendous amount of morbidity and mortality, then there is no real economy that comes from that. And so I think the focus still has to be on the public health side of things, and then the economy part in very much consideration of it. and in a parallel process, I think is important. I think that's what the governor is doing in a very, very, very responsible way. And I applaud her for that. And the rest of her advisors, I think, are doing good, and they're being very patient, especially from the business side. And I think that's important because they understand that if you move too fast, and then it's only going to make it harder to recover overall. So do we need a vaccine to come out of a full state of emergency? It's really hard to say right now. And you know, the reality is that a vaccine may never come. And we have to start thinking about what would that be like if we didn't have a vaccine. Now, would there be enough of this herd immunity that just naturally people get the disease over time and then start developing herd immunity? That might be the case. And that might be several years from, you know, a year from now, for example, until we can confer that. So, you know, that's how we wait. I know I'm not really directly answering your question, but it's because it's a very, very difficult question to answer without taking in all these factors.
Thank you, Patty. I also sent the slides that Dr. Cabrera shared with you all today in the chat. And just as a reminder, tomorrow we will be having a press conference with the governor, who will be unveiling